The last of our formal speakers this morning will be our college president, Mayur Lakhani. Mayur also steps down in a few weeks when I do. And his successor is the dynamic Professor Amanda Howe. I'm trying to see Amanda was sitting in the front row. Where is she now? Oh, over there, giving a wave. Hello, Amanda. Now, we all know Amanda well from her time as college honorary secretary and vice chair. And over the past few years, she has been president of the World Organisation of Primary Care, WONCA. But Amanda, it will be great to have you back in the team. Before I call Mayur onto the stage, I want to share with you that Mayur was our youngest college chair back in 2004, and he has been our most active of presidents, and he's put his heart and soul into being the best president he can be. His president's listening exercise has been a huge success, and we're now processing his brilliant report, Mission Possible, to see how we can use the insights to improve the college, your college, for the future. Mayur, I have hugely valued your friendship, your support, and at a personal level, so this is a big thank you from me. Please come and address conference.
Thanks so much. Well, Helen, thank you very much for the introduction, and it's been a great privilege to work with you. You know, the relationship between chair and president is all important, and we've achieved so much together. And to refer to your speech yesterday, in fact, I think we have been like two pieces of Lego, working together in the RCGP leadership model. We worked hard, non-stop, had fun, also partied, and as my children would say, we've had a blast in the last 2 years. So thank you very much for your collaboration. And let me now also celebrate the conference with you. I'm sure you'll agree that it's been an outstanding venture. I know Helen will give formal thanks at the end of this morning, but I wanted to thank you for making it a great success. I think I met many of you. Many a selfie were taken. And I do wonder now whether I should have charged for that. But you're absolutely wonderful. You know, I've learned such a lot from you. You inspire me, and I'm very confident. I remain very confident about the future of the profession. Let me make some broader remarks now, because occasions like this are an undoubted opportunity to celebrate our achievements, but to reflect on the challenges ahead. So this is my last speech to conference, at least as an officer, and it is an honor to close the event. But as a former chair and president, I want to add some personal reflections on our journey into the future. Perhaps I could call it general practice, past, present, and future. But I'll be doing that by glimpsing into the future consultation, which has the doctor, the patient, and Alexa in the room. What will that be like? But first, I want us to take pride in our achievements. I don't think we do that often enough. You, the conference, the content, is an embodiment of the progress we have made. This is the age of progress in general practice. We recognize the remarkable contribution that general practice has made to the care of patients, but not just that, the glue of the NHS, that we hold that together. We have come a long way. Actually, when the college was founded in 1952, the situation was very depressing. There was no organized general practice. Very few practices had any staff. The doctor's wife gave unpaid help. Some people say that's still the case. Surgeries were conducted in the doctors' houses or calling houses. There was no training. There was no voice for general practice. And there was no respect or standing for GPs. You know what GPs did? They changed careers and emigrated. From this idea emerged the College of GPs. So let's fast forward 67 years, only 67 years, and look how far we've come. One of the finest systems of general practice in the world, a list-based system of care, GPs working in many cases from purpose-built premises, the systematic use of electronic patient records, implementing successfully the world's largest chronic disease management program, team-based care, systems for patient participation, high levels of trust and confidence in GPs, one of the most highly rated public services, and GPs leading change in universities, in the NHS, in a myriad of roles. So it's no wonder that 1 million people will visit their GP practice every working day. 1.1 billion items are prescribed every year in England. For every full-time GP, 4.7 lives are saved every year through your public health intervention when you take somebody's blood pressure, although they've come in for something else. 4,392 practices take part in teaching and training, preparing tomorrow's doctors. 2,700 practices take part in research. And in 2018, 160,000 patients were recruited into clinical trials by their GP. And of course, we heard yesterday that we have the highest numbers of trainees. But that's not all. We have examples of individual GPs' brilliance. The GP using their sixth sense to diagnose meningitis in a baby with very subtle signs. The GP who uses the daffodil standards to give great care to vulnerable patients in a care home who read in the last years of their life. So I say this to you because how do you think that happened? That doesn't happen by chance. The story of the development of quality general practice, is the story of the development of the college. They're intertwined like double-stranded DNA. Your college, our college. So the college established general practice as a high-status discipline. It developed compulsory training for GPs in 1983. It sets the curricula and the assessment standards for new GPs. I think you will agree we can take pride in our achievements. But my challenge to conference today is that a glorious past is no guarantee of a glorious future. In fact, some people do say to me, and we heard Claire say earlier about rose-tinted spectacles, was there ever a glorious era in general practice, a golden age? I mean, I think there are some aspects to celebrate. So in the 90s, I got my MRCGP in 91, and I remember the best and brightest medical students went to general practice as a matter of choice. There was no recruitment or retention problem. 90 applicants for every partnership. I remember because I applied for those and was rejected frequently. But was there a golden age? Look at the things we can do now, the standards, the structures, the evidence, the involvement of patients. I'm not so sure, you know. In fact, when people talk to me about the halcyon days of general practice, I wonder if they're referring to the period when halcyon was prescribed. I don't know if you're too young to remember, but halcyon was a hypnotic drug, and it was frequently used to help people to sleep. So it looks more complex. But look, the case for improvement is very strong as we address our challenges and embrace the new frontiers in medicine, which I'm very excited about: digital, innovation, genomics, patient power, resetting the relationship between generalists and specialists. What do we want consultants to do? What do we want GPs to do? Because as a doctor, I want to do more for my patients. I'm frustrated by how we're being held back through systemic issues. We have more work to do. I'm sure everyone in this room will agree that no one can be happy with the quality of care that's being delivered. Neither patients, doctors, consultants, managers. Mrs. Patel has stage 4 cancer. Mrs. Smith cannot get a drug she needs because of a turf war over shared care agreements. Dr. Raj is overwhelmed by work, routinely works 14 hours a day and emigrates to Australia. And we have the scourge of modern medicine, which is iatrogenic disease. I'll never forget a patient I saw in 2005 with unusual and recurrent oral ulceration of the kind I've never seen before. We were struggling with the diagnosis. Ultimately, it was found to be due to a rare side effect of a drug called nicorandil, which is used for angina, and which was then prescribed only in hospital. New diseases that we're seeing may be iatrogenic disease. Who better than the family doctor to keep an eye on new things that happen. We see things every day that we don't understand. Barbara Starfield set this out as a strategic challenge for GPs, the identification of iatrogenic disease. You know what she said? Protect your patients from unnecessary investigation and treatment. And there's a translation gap. As we speak, research is being produced that patients need to benefit from. Who better than GPs to translate new discoveries and advances into everyday practice? So going forward, we have a strong vision for general practice. This vision is called Fit for Future. We have roadmaps to deliver the individual ideas. We know what good looks like. It's not rocket science. We have strong ideas for it. It's based on the enduring values of continuity, coordination, comprehensiveness, and first contact care. And our vision also embraces the two new frontiers that I want to discuss now, which is digital and genomics. I'm going to do that by future-gazing a consultation. Jasmine is 42. She lives in Leicester. She has type 2 diabetes and NASH, which is a form of autoimmune hepatitis. She's woken up by Alexa. And Alexa says, "Good morning, Jasmine. Your sugars have been running high recently, and you missed your appointment at the gym." It's Saturday morning, and they decide, well, what shall we do this weekend? Jasmine goes to the bathroom, and she looks in the mirror, and it's a smart mirror. And the mirror detects the bilirubin level in her eyes. And it's 40, which is more than a normal level. She uses the bathroom, and immediately the mirror has a red alarm that just bleeps constantly because she has blood in her urine, which is microscopic. But because it's a smart toilet, it's picked it up. And all this time, this data is being fed into Watson, the computer and artificial intelligence that's constantly processing this information. And is feeding it to Alexa's favorite GP, who is Dr. Helen Stokes-Lampard. And it automatically books an appointment with Helen because Jasmine prefers continuity. And she knows when Helen is available, and they book an appointment. So then they go shopping, and Jasmine's buying carbs, cakes, bananas, and she's a diabetic. So Alexa is telling her through her app, "No, put that back, put that back. That's not what you should have. That's not what you should have." She goes to the gym, and she gets a report about her activity. And then comes the appointment with Dr. Helen, who is well prepared. She has 15-minute appointments because that's very dear to her heart. And you know why she has 15-minute appointments? Because all the hard work has been done by Watson and Alexa. This data has been processed and risk assessed because Jasmine has been to Superdrug and has had her genes tested about 6 months ago. And it's been all put into this database. So before Dr. Helen sees Jasmine, there's a risk score, this is what you should do. The 2-week referral has been made automatically. That's already been sorted out. So we spend a lot of our time gathering data, but imagine if AI helped you get what's called the pre-diagnostic interpretation. Before the patient comes in, the hard work has been kind of done for you. So it allows Dr. Helen to do what she's superb at, which is the personal interaction. So instead of spending 13 minutes gathering data, looking for bits of paper, she spends 13 minutes talking to Jasmine, looking at her, exploring her ideas, concerns, expectations. So they come to a conclusion. And it's very powerful because the AI has got the genotype, got the phenotype, they've got Jasmine's lifestyle because the Tesco shopping is all analyzed to give you an idea of what she's doing. And of course, the environment, the air quality. And as the consultation ends, Jasmine leaves to the room. She is hesitant. She goes to the door and she has a hand on the handle and she turns around and she says, whilst I'm here, doctor, because that's not going to go away. And Helen, because she's FRCGP and well-trained by this college, knows this is very significant and calls her back in. And at this stage, Jasmine starts crying because her partner has left her. And Helen uses the tools of general practice, the care, the compassion, touch where that's appropriate, and the kindness. And that's the single most important intervention that day. So I based that on some excellent work on a report called Beyond the Fog by the Royal Free Charity, and a book by Eric Topol on deep medicine, where the arguments are that to create the space and time for us to be great doctors, we need to think smartly and differently. But the enduring relationship will never go away, because that's what people need. When they're sick and ill, they'll need a doctor who they trust and they know. So the final segment of my speech is to think through some conclusions. The college has always led the way in improving standards. Now you have a once-in-a-generation opportunity to help general practice by bringing in a new standard of individual practice and of practice services. Higher standards depend on a strong college, and strong college needs its members. So I'm very pleased to say that we'll be consulting on our new strategy from 2020 to 2023, which has at its heart members. Everything we do will have members at its heart to help you deliver great care, and that will be based and informed on my listening exercise. And looking at your service roles and your leadership roles, I know many of you are concerned about the extent to which general practice is externally managed and driven. Why should it be like that? We can shape the future. We have the tools and levers, more control and power than we think. I know there's a lot of change. Change is scary, but it's an opportunity to declare ambition and to be a catalyst. So let's seize the initiative by leading change. Imagine the power of that. 53,000 members, leading change, being advocates for their patients, embracing causes that are important in all parts of the UK, but united by their college, the RCGP, as the anchor institution that brings together GPs, that celebrates them, irrespective of their role, status, or origin. You know, I've noticed in this room you are very high achievers. Your leadership is absolutely essential. Let's embrace that and going forward to do collaboration, the Lego concept that we heard the other day. I know it's tough, and I speak as a working GP in Leicestershire, so I'll be back at surgery on Monday. I know I have some difficult consultations already planned and a home visit. But let's not negativity ruin our day. Remember the good things. Let's talk about them. There are more good days ahead. Hashtag more good days. So going forward, our mission is very simple. Will you please help me? We have to inspire trust and confidence in GPs and in general practice. Will you help me bring honor to the profession? How do we do that? Why are we such a great profession? Because of competence, because of care, because of compassion, and because of courage, particularly helping those who've been overlooked, either patients or doctors. These are the factors that make for trust. But leading factor amongst all those is competence. There is no substitute for that. And you will have to define what that means for your role. So, in conclusion, I want everyone today, after this conference, to commit to action. We can't change things alone in London, or in Edinburgh, or Cardiff, or Belfast. we have to work together because we can all do something. Lots of small changes combine to produce massive impact and improvement. So I'll present to you, and some of you will have heard this before, my president's 3-point plan. That's probably the last time I'm going to be able to say this, so let me enjoy it, and I hope you find that helpful, which is be the best doctor you can be on the side of patients, and I'll finish on this note, shape the future through leadership. Thank you. Thank you very much. Thank you. That's good. Thank you.
Thank you, Maya. That was fabulous. So, folks, that is it. It's the end of the 13th RCGP conference. I hope it has given you the most enormous boost, that you leave here energised, uplifted, but also that you've learned something you'll take away, that you'll put into practice, and that the coming year will be a great one. And I just very briefly, a few thank yous before we wrap up. I need to officially thank all our sponsors and exhibitors for their support and the stunning displays down in the exhibition hall. I want to thank the fantastic staff of the college, Haymarket and the conference centre here, who have worked their socks off to bring this together, and they've run it so brilliantly. I want to specifically single out Michael Mulholland, the officer lead for the conference. Michael has been absolutely brilliant. So Michael, I know this is your first conference, so thank you. But to those of you, the hundreds and hundreds of you who made the brilliant posters, and of course all our sparkling speakers, I know that these things take a huge amount of energy and preparation, and you are what make our conference. But the most important thank you is to you, our delegates, to our members. As a reward for being brilliant, amazing, fantastic GPs, I'm going to give you an extra hour in bed tonight, okay? My thanks to you all. You are utterly outstanding professionals. I'm going to get emotional. Safe journey home. See you next year in Glasgow.